Fox 17 News' Kathleen Jacob live at the Capitol tonight with reaction for us. Kathleen.
Of course, this is something that has people on both sides. You definitely have those small business owners who have been struggling through this time and they need those restrictions lifted. But then you have those health officials who worry about what's to come in the coming months. Today, we got to the bottom of Governor Lee's decision. It's tough to know what the right decision is. Since March, we've been telling the stories of struggling businesses.
I put my life and my blood and everything into this store, and I love it.
I don't feel like we're back to normal yet, but hopefully soon.
And it's those type of small business owners Governor Lee cited when he announced he'd be lifting all restrictions on businesses and gatherings in 89 Tennessee counties.
One of the things I'm worried about is that our businesses aren't operating fully and unrestricted, because that drives economic recovery and people's livelihoods are at stake there.
But also at stake, according to Dr. Ali Makdad, our hospital capacity with the increase in case numbers throughout the state.
Based on what's available today, there'll be a higher demand for ICU than what is available in Tennessee.
Right now, Tennessee's case positivity rate is at 6.8%, climbing to the 13th highest in the country, according to the AP. Many states still have Tennessee on a travel ban, and in September, we saw more deaths than any other month of the pandemic. We reached out to the governor's office to see what went into this decision given the climbing statistics. His office responded with this statement that echoed what he said in a press conference this week, pointing to a steady hospital capacity and indicating they'll take a targeted approach if and when they need to.
We're 6 months into this pandemic, and Tennesseans know how to assess risk. They know how to operate safely. And I have every confidence they'll do so.
Throwing his faith behind the Tennessee pledge as the state moves into new territory. That doctor that we spoke with is getting even more worried because we're about to be in those fall and winter months, flu season, so he encourages everyone to also get a flu shot. Live from Bicentennial Mall, Kathleen Jacob, Fox 17 News, your Code Red station.
Thank you, Kathleen. All right, we want to know if you oppose or approve of easing restrictions in the state of Tennessee. Jimmy Burkhardt posting, oppose, we're doing well and should not ease up. The improvement in the statistics is due to our restrictions. Keep it up and flatten the curve for good. Nita Billsmith posts, support if this is here to stay along with all the other viruses, then we learn to live with it. You can weigh in on our Fox Nashville Facebook page. We begin with the path forward. As of today, the number of COVID-19 cases traced to bars and restaurants in the city of Nashville is less than 1% of the total traced cases, and that is according to the Metro Health Department numbers.
Yet, as modified Phase 3 plan starts today, those same bars and restaurants find themselves still limited to 50% capacity. Fox 17 News' Dennis Ferrier has the story.
In the original Phase 3 plan in June, restaurants were open at 75%. With the numbers so low right now, the restaurant community is asking a very simple question. Why not let us open to 75%? 31 restaurants, bars, and cafes have closed in Nashville permanently this year, according to the Convention and Visitors Bureau. 20 of those say COVID is the reason they closed. Add another today as Zoli Coffee serves its last cup.
I think everything is fluid.
To say Mike Kelly is connected to the restaurant business is an understatement. Jimmy Kelly's Steakhouse has been open 86 years, and he vows it will stay open. But Mike Kelly says the recent closings are just the beginning.
Unfortunately, I think you're going to see a lot more in the next 6 weeks, 6 to 8 weeks. Again, a lot of restaurants receive the PPP money, and that money is running out.
As of Tuesday, only 146 cases have been contact traced back to restaurants and bars. Metro Health reports 95 cases were traced to bars and 51 to restaurants. That's since March. That's a little over 0.5% of the total number of cases contact traced by the health department. We asked Mayor John Cooper, why is he still holding restaurants to 50% occupancy?
Knowing that 50% occupancy in restaurants is an untenable number, it's been described as a ticking clock to bankruptcy, and also knowing that the restaurant numbers are so low, why not move them to 75% occupancy as you did in the original Phase 3 back in June, just to encourage their survival?
The short answer to your question is we're excited to get that number up, and when our healthy habits provide additional capacity to any industry in Nashville, we are beyond excited to add to it.
Mike Kelly wants everyone to understand 50% occupancy does not work.
It's tough. First of all, it's really tough for a lot of restaurants to go down to 50%. I mean, you just can't make it. You can't do the numbers. The restaurant industry has we have a very slim margin. If you want to make a lot of money, don't go into the restaurant business.
Mike Kelly says behind every restaurant closure is a lot of people losing their jobs. And these restaurants are not the national chains. They're local places that give this city its character.
For the rest of the year, Tennessee will receive thousands of Abbott Binax Now rapid coronavirus tests. They're very accurate if you have symptoms, and the results are immediate, potentially a great tool for nursing homes or schools.
They don't require any equipment. They don't require any machinery. They can be done just with trained personnel.
In all, the federal government bought 150 million of these tests. But this week, Health Commissioner Lisa Piercy wasn't sure how well they did for asymptomatic patients.
The bulk of those we know will probably go towards helping in schools, right? But a bulk of students in schools may be carrying this disease but be asymptomatic, right? But we don't know how well this does diagnosing asymptomatic cases yet.
So yesterday on the White House call, they did not specifically mention a sensitivity level in asymptomatic individuals. They did mention that in symptomatic individuals being 97%.
Knowing that answer will be critical, since many children carrying the virus won't show any or only have mild symptoms. Harvard Dr. Michael Mina told Dark Daily, the laboratory medicine journal, this is the type of COVID-19 test we've been waiting for, but may not be the test.
To my knowledge, has not yet published the sensitivity level of asymptomatic individuals.
But Piercy said she suspects it is better than the national average test, and it will need to be if Tennessee's school children depend on its accuracy. Tennessee is still making a plan about how it will distribute these tests, but if it's going to be used in schools and nursing homes first, especially on this first shipment, then it might be some time before this is available for broader public use. In West Nashville tonight at Hillwood High School, I'm Alex Apple, Fox 17 News, your Code Red station.
Alex, thank you. We're sending out a Fox 17 News push alert so you can learn more about these rapid tests. To get our messages, make sure you've downloaded the free Fox 17 News app and are allowing notification.
Cooper has been in office for 1 year now. Despite the city entering phase 3 of the reopening process today, he says that he is really concerned about the city's financial future. Fox 17 News' Harriet Wallace sat down with the mayor for a one-on-one interview.
Yeah, the mayor spent some time talking about having to juggle a number of crises at one time in his first year in office. He says not only did he have to deal with the tornadoes, but then the pandemic. And throughout this entire time, from the beginning to now, he's had to deal with the city's finances, and that's not getting any better anytime soon. Mayor Cooper said today that on day one of taking office, the city's finances were in the air. There was a tremendous amount of uncertainty and a threat from the state comptroller to take over the city's finances. The mayor said, of course, the pandemic and the tornadoes exacerbated the problem. But I asked him about Governor Lee denying his request for an additional $82 million to make it through the pandemic. Mayor Cooper said in this letter to the governor that hotel and short-term rental occupancy has dropped nearly 80%, just a snapshot of why the city desperately needs that money. Bar and restaurant owners have long criticized the mayor of shutting them down, some businesses folding during the pandemic. Governor Lee responded with some criticism of the mayor, saying he needs to reopen the city. Meanwhile, other state leaders are also calling for a review of the city's finances. Well, Mayor Cooper tells me today he welcomes that oversight.
People, we all want the same things. The governor and I want the same things. We want the recession to be over and for the public health crisis to be managed to where it affects very few people. I welcome the governors looking over our shoulder. It makes us better players, right? And it's going to make us do a better job.
And here's the bad news. The worst still may be yet to come. Of course, we've got the referendum that's hanging in the balance right now, but also There is a primary source of funding that the mayor says he was counting on, but that too may be jeopardized because of everything going on. What it is and what he's planning to do about it tonight at 9 o'clock.